Today we're going to talk about a hidden side of diabetes management. That deep, emotional exhaustion that so many of us feel, but we almost never talk about. This is an explainer on diabetes burnout.
Okay, let's just jump right in. We spend so much time talking about carbs, insulin, blood glucose, all the numbers. But what if I told you the real enemy, the thing that makes this all feel impossible sometimes, isn't a high reading, but just being completely, utterly tired of it all? If that feeling of just being done rings a bell, I want you to look at this number. You are so far from being alone. A 2024 global survey found that a staggering 79% of people with diabetes feel this way. Just let that sink in. This isn't some rare, fringe issue. It's basically the norm. It's the club most of us are in.
And here's the most important thing I want you to hear today. That feeling is not a personal failure. It's not a sign that you're weak or that you're not trying hard enough. It actually has a name. It's a recognized condition, and honestly, it's a totally predictable response to the 24/7 job of managing this disease. It's called diabetes burnout.
So what exactly is it? It's really important to get this straight. We're not just talking about having a bad day, or feeling frustrated after a stubborn high. This is something much deeper. It's a state of exhaustion that can sneak up on anyone, even people who, from the outside, seem to have perfect control.
The official definition published in the journal Diabetes Care really nails it. It's being so emotionally and physically worn out by the constant demands that you start to check out. You disengage, you start to feel hopeless. It's not about being lazy, it's about running on empty and feeling like nothing you do matters anyway.
And this right here, this is exactly why it's not your fault. Think about it. Diabetes never takes a vacation. You're making over 180 extra decisions every single day. You can do everything by the book and still get a wild number. Then you've got the pressure to be perfect from yourself and sometimes from others, plus that little voice in the back of your head worried about the future. It's the perfect storm for burnout.
Now this is a really important distinction to make. Burnout and depression can feel super similar, and they can definitely overlap. But burnout is laser-focused on diabetes. It's an exhaustion tied directly to the tasks of managing it. Depression, on the other hand, tends to cast a shadow over all areas of your life. And here's the key. With burnout, if you can lighten the diabetes load, you often start to feel better. Depression usually needs more direct clinical treatment.
So how do you know if what you're feeling is actually burnout? Let's walk through some of the warning signs. And I just want you to ask yourself honestly, does any of this sound familiar?
This thought. This one right here is the absolute heart of burnout. It's that voice that whispers, "Why are you even trying? It's not going to work anyway." It's that deep feeling of hopelessness that makes you just want to give up. It's a dangerous place to be, but it is so understandable when you're just plain exhausted.
And that why bother feeling, it starts to show up in what we do, or what we stop doing. Maybe you find yourself forgetting to check your blood sugar because you just can't stand to see another number. Or you start sleeping through your CGM alarms, not because you don't care, but because you're just so tired of being beeped at. These aren't signs of being a bad diabetic. They are massive red flags from a mind that's completely overwhelmed.
And oh man, the emotional toll is just huge. It's that constant feeling of being defeated, like you're in a fight you can never win. It's being angry and resentful that you even have to deal with this, and then feeling guilty for being angry. It's this horrible cycle that makes you just want to pull away from everyone and everything.
Okay, that was the heavy stuff. We've defined it, we've looked at the signs. But now we're going to talk about the most important part, the way out. Because recovery is absolutely possible. And it doesn't mean you have to try harder or add more things to your to-do list. It actually starts with the opposite.
This is it. This is the whole game. The first step on the path to recovery isn't some new gadget or diet plan. It's just giving yourself a break. It's giving yourself permission to not be perfect. It's accepting that good enough is not only okay, it's actually a brilliant, sustainable strategy for living with this thing for the long haul.
So what does that actually look like? Well, first, embrace good enough. Seriously, stop chasing 100% time and range. 70% is an amazing clinical goal. Second, simplify. What are the one or two most important things? Maybe it's just taking your insulin. Focus on that and give yourself permission to let the other stuff slide for a bit. Third, connect with people who get it. Find a support group, even online. It makes a huge difference. And finally, please be kind to yourself. That voice inside your head needs to be your biggest cheerleader, not your biggest critic.
But here's the tough reality. Look at this.
the vast majority of us are suffering in silence. Only about 1 in 4 people ever bring this up with their doctor. Being brave enough to be in that 24%, to be the person who speaks up, that can literally change your life.
And to make that just a little less scary, here is a literal script you can use. You don't need a big speech, just starting with, "I'm feeling exhausted by all of this," is so powerful. Ask if you can simplify things for a while. Ask what mental health support is out there. A good doctor will understand that this is a critical piece of your health data.
And this is what it all boils down to. If you take away only one thing today, please let it be this. You are not alone in this feeling. And your mental health isn't some extra optional thing. It is a fundamental part of your overall health and your diabetes management.
And if you need any more proof that you're not alone, just look at this. This is the shared global experience of diabetes. The numbers for burnout, anxiety, and even stopping treatment because of stress are all incredibly high. It's so clear that the emotional struggle is just as real as the physical one.
Since so much of this comes from the sheer mental load, anything that can reduce that daily burden is a game changer. And this is where technology can be an amazing ally. For example, tools like Health Gheware are built for this very problem. They use AI to analyze all the data for you, so instead of drowning in numbers, you just get clear, simple insights. It's about letting tech do some of the heavy lifting.
So let this be your new mantra. Say it to yourself. It is okay to struggle with something that is genuinely difficult. Living with diabetes is hard. It's not a character flaw to find it overwhelming sometimes. It's just reality.
So I'll leave you with this question. This isn't homework. It's not another task for your list. It's just a thought. What is one small, tiny thing you can do today, maybe even right now, to be just a little bit kinder to yourself?
And finally, of course, a very important disclaimer. We've talked a lot about burnout today, and this is all for informational purposes. If what you're feeling goes deeper into severe depression or thoughts of harming yourself, please reach out for professional help immediately. There is always help available.